So hey guys, what's up? So welcome to World News 20 News channel. So let's talk about in review what does COVID-19 to central nervous system. As a respiratory disease, COVID-19 primarily attacks the lungs, but other effects too have been emerging, including in the abdomen, the skin, and the brain. A new study has reviewed the existing evidence about the virus's impact on the central nervous system. Researchers from the University of the Cincinnati and through Italian institutions have reviewed neuroimaging and neurological symptoms in patients with COVID-19 and published their findings in the journal. Radiology. Altered mental status and stroke have been found to be the most common neurological symptoms in the COVID-19 patients. The authors say this could help physicians notice red flags earlier. Studies have described the spectrum of chest imaging features of the COVID-19, but only a few case reports have described COVID-19 associated neuroimaging findings. Lead author Abdelkader Mandemi, assistant professor of the radiology at the University of Cincinnati, said in a statement to date, "This is the largest and first study in literature that characterizes the neurological symptoms and neuroimaging features in COVID-19 patients. These newly discovered patterns could help doctors better and sooner recognize associations with COVID-19 and possibly provide earlier interventions." Researchers investigated neurological symptoms and imaging findings in patients from three major institutions in Italy: University of Brescia, University of the Eastern Piedmont, Navarra, and University of Caesarea. The study included images from 725 hospitalized patients with a confirmed COVID-19 infection between February 29 and April 4. Of these, 108, 15% had serious neurological symptoms and underwent brain or spine imaging. Most patients, 99%, had brain CT scans, while 16% had a neck CT imaging and 18% had brain MRI. Investigators found that 59% of the patients reported an altered mental state and 31% experienced stroke, which were the most common neurological symptoms. Patients also experienced headache, 12%, seizure, 9%, dizziness, 4%, among other symptoms. Altered mental status were more common in other adults. If you like the channel, so kindly subscribe to it.